Arthrography by Melissa and Vanessa. Before we talk about arthrography, we wanted to talk about what is arthrology. Arthrology pertains to radiography of a joining space and its surrounding structures. All joint junctions of the human body are between cartilage and bone, and they are classified into three main categories based on their function: diarthrodial, freely movable; amphithrodial, slightly movable; synothrodial, immovable, and they're also classified by structural features such as fibrous, cartilaginous, and synovial. Synovial joints take their name from the synovial fluid within the joint space. Synovial fluid is a clear, viscous fluid that works as a lubricant to facilitate joint movement and help with frictionless movement on the joint surfaces. Synovial fluid is produced by the synovial membrane, which is the inner lining of the joint capsule and is enclosed with fibrous layer called joint capsule. What is arthrography? Arthrography is a medical imaging test used to visualize the joints in the human body through the injection of contrast agent into the joint space. Here we have a video provided just to get an idea of what is an arthrogram.
Direct versus indirect arthrography. Both direct and indirect arthrography enhance visualization of the joint space after imaging of the joint is performed. Indirect arthrography is a technique in which contrast material is injected into the bloodstream and eventually absorbed into the joint. For direct arthrography, the contrast is injected directly into the joint by a radiologist. Direct is preferred because it distends or enlarges the joint, allowing for enhanced visualization of small internal structures. This also leads to improved evaluation of diseases or conditions within the joint. Methods of direct arthrography. Conventional direct arthrography of a joint often uses a special form of X-ray called fluoroscopy to guide and evaluate the injection of iodine contrast material directly into the joint. In some cases, ultrasound may be used to guide the procedure. Other methods of direct arthrography examinations may also use MRI or CT following contrast material injection into the joint. While arthrography is most commonly used to examine the knee and shoulder joints, it may also be used to look at other joints such as the wrist, ankle, hips, shoulders, foot, jaw, and spinal joints.
Arthrography can be performed with a negative contrast agent, which is typically 100 to 150 milliliters, or positive contrast agent, or if a pneumo arthrogram uses air or other gases. Arthrograms have been typically performed during fluoroscopy to capture a live image and movement of the joint, but is now being more commonly replaced by MRI and CT. Depending on the joint being examined, most doctors will perform an arthrogram under fluoroscopy and then recommend a follow-up MRI or CT for further imaging. The duration of the procedure varies, but the average time is about 45 minutes to complete.
An arthrogram procedure tray includes sterile dressing, syringes, alcohol cleansings, spinal needles, puncture needles, lidocaine, gauze, and tubing.
How to prepare for an arthrogram. Before the procedure, your healthcare provider will explain the procedure and you will be able to ask any questions beforehand. You will also be asked to sign a consent form for the procedure to be done. There is no restrictions of diet or activity before the exam. If you have any allergies to contrast, be sure to inform your healthcare provider. And here we provided a video for you guys to see what an arthrogram typically looks like.
During arthrography, X-rays of the joint may be taken before the injection of the contrast dye for comparison with the pictures taken after the dye is injected. The skin around the joint will be covered with sterile drapes and cleaned. The joint will also be numbed by using a small needle to inject local anesthetic. If there is fluid in the joint, this fluid will have to be removed with a longer needle or syringe. The contrast dye will then be injected into the joint using a thin needle. You may experience pressure as the needle is moved into the joint. After the injection, you may be asked to walk around or exercise the joint so that the dye is distributed throughout. Once the contrast has moved throughout the joint, multiple x-rays will be taken in various positions. After the procedure, the patient should rest the joint as much as possible for 24 hours. If there is swelling in the joint or tenderness, you may apply ice. You may also take over-the-counter pain reliever. If there is swelling or tenderness that lasts for more than 2 days, contact your doctor. An arthrogram may also use fluoroscopy, CT, or MRI instead of x-rays to get better pictures of the joint.
Indications for an arthrography. Arthrography may be done on a joint where there has been persistent and unexplained pain, loss of motion, and/or changes in the way the joint works. Other reasons could include to find problems such as tears in soft tissues of the joint, to check for problems from repeated dislocations of the joint, to check for prosthetic joints, or to look for loose bodies. Risk of arthrography. Some risks of arthrography include infection and bleeding at the needle site where the contrast dye was injected, or an allergic reaction to the contrast dye, which is rare with direct arthrography because the dye is not directly injected into the vein, but could always be a possibility.
Contraindications for this procedure include infection in or overlying the joint, pre-existing infections, or allergic reaction to contrast medium.
And these are our citations. Thank you everybody for watching.